Hi, my name's Carl Steigerwald. I'm here today to talk to you about long-term care. The takeaways for our time together today: what is long-term care? Who needs long-term care? The benefits that are payable under the long-term care contract, and how do we go about qualifying for those benefits? Long-term care insurance. Long-term care is care that pays for individuals who are requiring care for an extended period of time due to illness or disability. The contract itself is designed to cover various issues such as nursing home care, coverage for home-based care, coverage for nurses to come in and visit you, chore services, and such things as respite care for daily caregivers, and even adult daycare. We've got a very unique situation that we encounter nowadays. We have what is called a sandwich generation. We've got people that are taking care of their own children and also taking care of aging parents, and that adult daycare benefit becomes a very real necessity for those types of families, and we'll look at that. Proceeds of our qualified long-term care policy are generally received income tax-free. The premiums that are paid on this contract oftentimes are going to be tax deductible as a medical expense, as long as they exceed or they provide, they're within certain limits as set forth by the IRS. A lot of times it would have to exceed 7.5% of your adjusted gross income. Who needs long-term care insurance? Well, that's interesting. Everybody. When you get right down to it, what we're trying to do here with the long-term care contract is provide protection for personal assets, what is oftentimes referred to as asset preservation. This is something that can be used for the purpose of maintaining daily living expenses and taking care of everyone. I mean, everyone who's got assets out there is definitely in a position where they're going to need long-term care or could use long-term care at some point in time in the future. The types of benefits that are available for payment under this contract: nursing and rehabilitative services, care that is required on a daily basis. The skilled nursing care can be performed by any skilled medical practitioner or doctor, anyone with a degree in nursing services. We have to have somebody who is a skilled provider that is providing benefits under skilled nursing care. We have intermediate care, nursing and rehabilitative services that are required occasionally, usually provided in-home. These can be performed by skilled medical practitioners or anyone with a degree in the nursing sciences, and again, based on doctor's orders. Custodial care. Custodial care is probably, out of all of these, the most devastating. In most instances, what we are looking at is we are looking at care that is helping this person just make it through the day. This helps the person perform activities of daily living, which will be referenced and we will talk about repeatedly. They're ADLs. The activities of daily living. The idea here is, again, we need someone with a medical degree, someone with medical skills, a skilled practitioner that is there for the purpose of assisting this person to make it through the day. One of the things that's important to understand about custodial care, it is not covered under our Medicare policies. Home health care. One of the things that I used to think of all the time, and I had a unique opportunity recently to go out and to visit with some folks in a nursing facility, and had an opportunity to speak to some of the residents. And my mindset had always been that home health care would be what I would want, because whenever I'm not feeling good, I want to go home. I asked one of the residents in the facility, I said, why is it that you're here and why not at home? The resident said to me, I have people that are surrounding me here that I can relate to. When I was at home, I didn't have anyone there visiting me. So if we've got a younger person who does have people that are surrounding them in their home, this is a great benefit to have. But for others who don't have the support of family any longer, home health care is not necessarily something that they're going to revel in. It's not necessarily something that they want in their policy. But it's there, it's available. We can include skilled nursing care and various types of therapy that will be provided. Again, help with the activities of daily living and help with housework. Generally, it will not be paid to a family member, though. It has to be somebody who has been hired to perform these services. Adult daycare, as I mentioned to you previously, also a very, very big issue when we look at this. This provides supervision and social or recreational support during the day for people who live at home and are functionally impaired adults. The idea here is that this type of care can include transport to and from a daycare center and a variety of health and social and related activities that are provided for the benefit of this individual. As I mentioned, we've got a sandwich generation that we're dealing with. Oftentimes I'll call and talk to a client and ask them a question about when I might be able to meet with them. And it's interesting because what they'll tell me is that I'd be able to meet with you at 7 o'clock. I have to pick the kids up from daycare and I have to pick mom or dad up from adult daycare. So adult daycare is becoming a very real part of our society today, and the policies that we sell provide coverage for just that type of care for these families. Hospice and respite care. Hospice care. Hospice care is where we have someone who is in a position where they are terminal. This is primarily focusing on pain control for the individual, comfort for the individual, and counseling for the terminally ill individual and for the family members. When we look at hospice care and we look at respite care, this is designed to cover the cost of replacing primary caregiver. Oftentimes, when we talk about this, it's kind of humorous because we look at it and we say, what we're doing is we're giving the person who is suffering from the malady an opportunity to get away from the caregiver, and we're giving the caregiver an opportunity to get away from the person who they're taking care of. The beauty part of the hospice care benefit is that it will provide coverage for a short period of time to provide an opportunity for the primary caregiver to take a vacation. The great part of the hospice and respite care benefit, the respite care benefit, no elimination period. We're in a position where there's no need to pay any type of a deductible. It's just providing coverage for a short period of time. Some of the common provisions that we find in the contract. Eligibility to purchase. What age do you have to be to buy a long-term care contract? 18 to 89 years of age is available for purchase. Common age where we see this contract being bought is 50 to 60. That's not the limitation. That's where we see the majority of these policies being written. But again, keep in mind, anyone from 18 to 89 years of age is eligible to purchase one of these policies. Guaranteed renewability. The current generation of long-term care policies are guaranteed renewable. This policy cannot be canceled other than non-payment of premium. The insurance company here does reserve the right to raise the premiums, to increase the premium on this contract. However, the only way that this can be done is if it is done by class of insured. It cannot be done on an individual basis. If we're going to increase the premium, we have to increase it for everyone in a specific class of insureds. Some of the long-term care policies are non-cancelable contracts. Non-cancelable, meaning that the insurance company cannot cancel this policy ever. The only way that this policy can be canceled is due to non-payment of premium. The insurance company has absolutely no opportunity to make any changes to this policy. They cannot change the premium, they cannot change the rate, they cannot do anything in this contract. The only way that this policy is ever going to cease is if there's non-payment of premium. Be advised, this is an expensive policy. You've got to think about it from this perspective. Now the insurance company, in essence, and I know this sounds callous, but they're kind of stuck with you. There's not much they can do about it at this point in time. Waiver of premium. Waiver of premium. Almost every contract out there will automatically incorporate a rider on the contract for waiver of premium. That in the event that this policy is being used and has been used for a period of 90 days or longer, the premiums on the policy will be waived and no further premium payments are due, and the policy will stay in force. The premium payment will generally resume, if you will, when the care ceases. So if this person were to be using the policy and they're in a long-term care and nursing facility or assisted living facility, and then for whatever reason they exit that facility and care is no longer being provided, the premiums will then resume. Now, should they go back in for another covered benefit service, they would again be able to incorporate the use of the waiver of premium, but stipulated on that 90-day window of opportunity that we were looking at here. The benefit amount. The maximum daily benefit. This is how much is going to be paid by the insurance company for a covered service that's being provided, whether that be in a nursing home, whether that be in an assisted living facility, whether that be in a home health care situation. And this would be an amount that is chosen. This is an elective choice made by the consumer. We also have a maximum policy benefit. So previous it was a maximum daily benefit. Now we have a maximum policy benefit. The maximum policy benefit is typically calculated by multiplying the daily benefit times the number of days in the benefit period. And this again can be an amount chosen by the insured, 1 year, 5 years, 7 years, whatever they feel most comfortable with. More often than not, we look at a 3 to 5 year window of opportunity. If we were to look at the typical coverage time frame, it's usually 3 to 5 years. Many policies specify the dollar amounts that are going to be per day, be paid out per day. And again, that would be paid in a skilled nursing situation. So the benefits will typically be, and to put it into perspective, it might be $200 a day. It might be $250 a day. One of the things that you need to do as the producer is check in your area. Determine what are the daily amounts that are typically being looked at in a lot of these nursing facilities, and then find out from your client, are they planning on being in this area, or are they planning on moving? When they retire, where are they going? And then check that area as well. But again, we need to look at the policy and what is the daily benefit that's going to be payable under this contract. There can be a deductible that is applied, and in a lot of cases there is. The deductible usually has to be satisfied before the policies will begin to pay. We'll talk more about the deductibles here in a little bit. The deductible is called the elimination period. Maximum period for which benefits are going to be paid, and again, as I mentioned to you just a bit ago, it's usually a 3 to 5 year window. Typically, that's what we look at. Some policies can contain both a benefit period per stay on a daily basis or a maximum time frame for stay, and again, in that 3 to 5 year range. Benefit triggers. How do we start the benefits coming on this contract? This goes back to what I addressed with you just a little bit ago. This is the activities of daily living. Now, I've heard a lot of different people talk about this in a lot of different ways, but one of the best that I've ever heard, and one that I want to share with you, it's the first hour or so of every day of your life. When you get up in the morning, tell me you haven't wet the bed. Continence, controlling one's bladder or one's bowels. This is the first of the 6 activities of daily living. The mere fact that you can get up and get out of bed. Transference, the second of the 6 activities of daily living. You get up, you get out of bed, you go to the bathroom, and you go to the bathroom. Toileting, the third of the 6 activities of daily living. You get done going to the bathroom, you draw a bath or turn on the shower, you get in, and you bathe yourself. The fourth of the 6 activities of daily living. You get done bathing yourself, you towel yourself dry. You get out, you go over, you transfer yourself to the closet, and you get dressed. The 5th of the 6 activities of daily living. You get done dressing yourself, you transfer yourself to the kitchen, you make breakfast, and you eat it. The 6th of the 6 activities of daily living. We have continence, transference, toileting, bathing, dressing, eating. First hour or so of every day of your life. If you can't remember that, you're suffering from a cognitive impairment, you're still covered. The elimination period, talked to you about that a little bit ago. This is your deductible. This is the length of time during which our insured would file a claim, let us know that they need coverage under their policy, and then they would have to wait for this period of time before becoming eligible to start receiving a benefit. This is the elimination period. It does serve as a time frame deductible. The length of this period is a length of time chosen by the insured from options that are made available by the insurance company. What ends up happening in most instances is that our insured will typically select a time frame, usually around 100 days. And again, the reason for that, which we will address in a minute, is because Medicare does have a benefit available that would provide coverage for the first 100 days. Some things that are not covered, some common exclusions, some that still remain would be such things as war and acts of war, alcohol or drug dependency, self-inflicted injuries, mental illness and nervous disorders without a demonstrable organic cause. However, be advised, please, Alzheimer's disease cannot be excluded from coverage under this contract. Optional provisions and riders. In many states, there is an optional provision that must be made available to every person buying the contract, and that optional provision is inflation guard. The inflation guard is going to be set up in a manner that will afford the owner of the contract the ability to have the daily and lifetime maximum benefits increased incrementally by a specified percentage. And again, that would be year after year after year. So year on year, that would be when these benefits would be provided. There's also a guaranteed insurability rider that will be made available on a lot of these policies. This guaranteed insurability rider allows the insured to purchase additional amounts of insurance at specified dates without having to provide evidence of insurability. Now, in the event that our insured chooses to exercise this option, they can do so and they will pay their premium based on their attained age. So there is no underwriting required. You don't have to go back through re-entry for the purpose of securing this additional coverage. But again, based on your attained age, you will pay an increased premium for this increased benefit. Think of it in terms of buying insurance on your insurance. We also have an option for a non-forfeiture benefit, and in a lot of states, again, this is going to be a benefit that is an option that must be provided. This is a very interesting benefit. What ends up happening is that we've got someone who has been paying premiums into a contract for a period of time. Let's say 10 years. They've been paying $2,000 a year for 10 years. So that means over the course of this 10 years, they have paid in $20,000 into this policy for premium purposes. Let's say that the policy that they had purchased had a $200 a day benefit. With the non-forfeiture benefit, should this individual, should our insured fall on hard times and not be able to afford to pay their premium, in most instances, the policy would lapse. However, with the non-forfeiture benefit, even if the policy lapses, the benefit that has accrued up to this point, based on the amount of premium paid and whatever the daily benefit amount was, will stay with this person and they will be allowed to carry it into the future and use it should it ever be necessary at some future date. So you can see the non-forfeiture benefit is incredibly important to your client. Qualified plans. When we're talking about qualified plans, we're talking about the idea that is this plan going to be something where we are going to have the IRS recognize it for the purpose of being tax qualified. The qualified policy must stipulate the insured be incapable of performing at least 2 of the 6 activities of daily living without assistance for at least 90 days in order to be qualified for benefits. A physician has to certify the insured is chronically ill. New federal standards require the following consumer protections that determine whether a long-term care policy is tax qualified. It must offer as an option inflation protection. It must offer as an option non-forfeiture provisions. And it must impose additional disclosure requirements stipulating that the proceeds payable are not taxable and that the premiums that have been paid can be tax deductible under this program. Long-term care and Medicare and Medicaid. We're looking at them in a comparative nature. What we've got here is we've got Medicare. Medicare is not designed to take care of providing any type of custodial care. It will not cover nursing home care if part of the treatment for the covered injury or illness is going to put this person into a custodial position. It does require a very specific set of circumstances that have to take place. Our Medicare recipient would have to be admitted to a hospital for a Medicare-covered service. They would have to be hospitalized for at least 3 days, a minimum of 3 days. Upon exiting the hospital, let's say our person has broken a hip. As a result of this hip break, they are now having problems with ambulation. And as a result, what we end up with is somebody who needs to be admitted to the nursing home for the same reason that they were hospitalized. As long as that is the case, 3 days or longer in the hospital, admitted to the nursing home for the same reason that they were hospitalized, they will have coverage provided under Medicare for 100 days. But it must be a skilled nursing facility. And please be advised, no benefits will be provided after the 100th day. As far as Medicaid is concerned, in order for our insured to qualify from a Medicaid perspective, this individual would have to prove financial need. Normally, this would require the individual has to be able to spend down all of their resources to what is considered to be poverty level And again, that will be predicated by the government. They will stipulate what constitutes poverty level. To recap, we talked about what is long-term care. Long-term care is care that is needed for an extended period of time to deal with the prolonged effects of illness, injury, or indeed old age. Who needs long-term care? Pretty much anyone could be in a position where they would be able to utilize long-term care. The benefits, we have benefits for skilled nursing, we have benefits for assisted living, we have benefits for home health care, we have benefits for adult daycare. How do you qualify for a benefit? Typically, you would have to be able to prove that you cannot perform at least 2 of the 6 activities of daily living, and you would have to be able to prove that you can do that for at least 90 days. Thanks very much for your time.